On March 11, 2020, the World Health Organization made an announcement.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold. COVID-19 can be characterized as a pandemic.
The coronavirus or COVID-19 disease has already devastated South Korea, China, Iran, and Italy. And this was a warning for other countries in which this disease was spreading quickly.
In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
The spread of COVID-19 was something that could no longer be stopped, but we can slow the spread of the disease. We just have to act now.
Okay, so we are in Miami Beach right now, South Beach specifically, and I want to document how the impact of this virus, how this virus has impacted this city. And let's just pass through all the restaurants and see, and through the streets and see, how massive of impact this has been for the city. Okay, so this is Ocean Drive on spring break on a Tuesday afternoon. This is almost ghost town. This normally would be packed of college kids partying and stuff. All of the restaurants are closed. The beach is closed. You cannot go into the beach. This is Mango's Cafe, closed for the first time in 29 years. Clevelander, closed. And one of the ways that we can help out the restaurant industry, it's by staying in and ordering out. Just call your favorite restaurant and order. So help out, order out.
Someone with COVID-19 usually develops a fever or a cough. Aches, pains, and other mild symptoms are also possible, but are less frequent. But the severity of those cases varies, and for some people who got the virus, you may never show symptoms at all. In 80% of the cases, people experience only mild disease, but in 20% of the cases, the disease can manifest in a more serious way. Overall, it seems about 1 to 2% registered cases lead to death. But that rate is lower for the younger people and higher for the elderly. The virus also seems to be very contagious, even more contagious than the seasonal flu.
But it certainly spreads better. Probably for the practical understanding of the American people, the seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than the seasonal flu.
After getting infected, it could take an average of 5 to 6 days before you start getting sick. But you can already spread it to people at this period, even if you feel healthy. That's how the virus has been so effective in spreading across the world so quickly.
We cannot say this loudly enough. All countries can still change the course of this pandemic.
And that depends on something we all need to do to stop this virus. In any hospital, the capacity to treat patients is limited by how many beds they have. Think of this as the number of beds in your local hospital at any given time. A couple are already filled by patients receiving treatment for things like a car accident injury or a stroke. And this icon represents one person who's healthy and decides to go out like usual. They jump on the subway and head into the office where they catch COVID-19. But they don't feel sick right away and might not for several days. So later they go to a basketball game where they unknowingly infect 2 or 3 more people. Most of these people will have relatively mild cases, but one might be an elderly person with a severe case who will eventually have to go to the hospital. But this person who is already infected and don't feel sick goes out again. On the subway, into the office, and then out after work, infecting several more people. 20% of whom will need to go to the hospital. Over a short period of time, this process multiplies the number of people going to the hospital every day. Before long, the hospital is full and a crisis begins. People with severe cases of COVID-19 can get treatment, and some who could be safe dies. Plus, people with other issues can't get treatment either, and some of them die. This surge of severe cases causes avoidable deaths. That's what happened in South Korea, Iran, and Italy, all of which went from 100 to 5,000 cases in less than 2 weeks. This surge was made of only the severe cases, but it was generated by people who didn't feel sick, spreading the disease in public. Which means the people who can do the most to avoid these unnecessary deaths are these people. And that means all of us. To slow the virus down, you need to act as if you already have it. By avoiding public transportation, the office, crowded places, and even small social gatherings, you decrease the chances of both getting the disease and spreading it. This is called social distancing. If enough of us do it, the virus will spread, but much slower. Over time, many people might still get infected, but fewer severe cases show up to the hospital each day, never overwhelming the system. This curve gets flatter, these people can all get treatment, and fewer people die because of it. These are the 2 ways that COVID-19 pandemic can play out. But this one only happens if everyone does their part. And it's why experts and officials are urging people to flatten the curve by social distancing and staying home as much as possible.
We are on our way to a supermarket, to a really big supermarket, to document a little bit of the experience of going to buy groceries in this crisis that we're going through right now because of the virus. Safety first.
There's no cleaning materials. There's no toilet paper whatsoever anywhere in the store. Closest to toilet paper that you can find is this, which is like facial tissue. But other than that, no toilet paper. Okay, I want to talk about the toilet paper situation.
there is an increasingly amount of people buying toilet paper out of nowhere for no reason, because toilet paper does not cure the virus. Toilet paper doesn't have to do anything with the virus. And the problem that causes is that when someone uneducated, operating straight off out of fear, goes in and buys more than what he needs, for example, buys the whole shelf, then an elderly person that really needs some toilet paper just like anyone else goes in and doesn't find it. And elderly people are the ones that are more vulnerable right now. They are not supposed to be going out, they're not supposed to be in contact with other people. So that's the problem that causes buying or operating straight up out of fear.